are back here at Performance Medicine in Kingsport, joined again by our daytime doc, Dr. Tom Rogers. And Dr. Rogers, thanks for having us out today.
Thank you.
Well, normally we talk a lot about men's health, but today we're going to focus on the women, and specifically talking about hormones in women.
Right. We've brought in Dr. Dave Martin, a good friend for years, and who probably in this area at least, he's the authority with women's hormones. He uses a lot of bioidentical hormones. We've kind of been on the same page for years as far as what we do for prevention. And certainly with bioidentical hormones, we feel that they're much safer, and women need them. And there's a lot of controversy about, you know, do they cause breast cancer? Do they cause heart disease? But so I thought I'd bring Dave in here and he can kind of talk a little bit about that.
And one of the things you say is you really got to keep things in perspective.
Absolutely. It's not misinformation. It's focus on information that may be highlighted a little bit too much. So if you only look at the risk and not the benefit, you're not getting a true picture.
Okay, and put that in perspective for us and what we're actually seeing when it comes to this type of hormone.
Well, I think the big thing with hormones historically has been breast cancer and heart disease increase. The increase is definitely there on synthetic hormones. The bioidentical hormones, we probably don't have enough studies to comment on. And the synthetic hormone, the risk really isn't that high in comparison.
Can you tell us a little bit about the difference in the two and what women are going to see?
The difference in the bioidentical hormone is trying to replace multiple hormones to resolve these symptoms. Synthetic hormones are patented, and they're based on just one or two symptom relief areas. So, for example, hot flashes, night sweats, mood swings, dryness, sex drive issues, weight changes are multiple symptoms. Most of the synthetic hormones are just geared to control the hot flashes.
Okay. So what kind of relief are you seeing from some of the patients that you have on these types?
Historically, within a couple of months, we'll see people that have better sleep, the hot flashes and the night sweats resolve, libido comes back, they feel more like how they used to remember how they used to feel.
Yeah, and I was going to say for some of these women, it's life-changing. It's like they get their life back.
Absolutely, and that's the word they say. They come back and they said, "You've given me my life back." So.
And that's one of the things we hear both in men and women. When they're at that right level, it can mean all the difference.
Right. A lot of times we'll have couples that come in, and if one is tuned up but the other one isn't, it's not good. But Dave certainly does a great job with the bioidentical hormones as well as preventive medicine. I mean, you find very few OBGYNs who are as in tune and interested in their patients' overall health. I mean, he does a lot of stuff besides the gynecologic type stuff.
And you said it's usually maybe in your 40s that you're going to start maybe seeing some of these symptoms?
Yeah, a lot of the symptoms, the perimenopausal, so most women, menopause is around 50, 51, but you can have symptoms of menopause as early as your 40s. And those include the hot flashes, the night sweats, and they can come and go in your 40s. You can do some low-dose hormone therapy, especially the bioidentical. I found pretty successful in controlling those.
Seems like everything is kind of on a case-by-case basis.
Absolutely, and that's why sometimes evaluating with labs, evaluating personally as far as symptoms, and you know, I've been doing it for 20 years, so it helps to have 20 years experience of, you know, bringing that to the table as well.
I certainly see a lot of parallels in the thought process between both of you. It's exactly what you've said over and over again. You got to do the labs, you've got to see what you're dealing with.
Right, you can't prevent what you can't predict. So that's something we always go by. So we do a lot of preventive medicine here, and I'm impressed with Dr. Martin and his interest in doing this type of medicine.
Well, certainly a very important topic today. A lot of relief for a lot of people out there if they are suffering from some of those symptoms.
Absolutely.
Help is available. For more information, you can always check out the website. We've got performancemedicine.net right here in Kingsport.